after you do that, you can reform it. Because when Social Security started out, it started out highly imperfect. A lot of people fell through the cracks, most notably black people weren't allowed to enroll in the program. But that changed over time. The way the healthcare reform works right now, I think, is just getting your foot in the door and making it perfect over time. So I think it is a success in that it marks the start of a great process.
And I agree that to that point, Social Security is now going to be because of demographics and where we are. So there's much still to do there. I think that I don't think the time is to wait and hope that it works, but to actually start doing things that you know. I guess that's, and when both sides are complaining, it seems that now's the time to do something, not sit back and go, oh, I hate this. I mean,
yeah, one of the concerns I had about this was for businesses over 100, if the ones offering insurance had dropped their coverage or their plans, because of the costs, and the workers selected to have income versus insurance, it's going to mean less income for the people who are under the plan, because there's going to have to be a way that companies that are, especially nonprofits, that are operating on real narrow margins anyway, and are going to have revenue reductions as the way the economy's going. I see that as a potential real issue. They couldn't afford it in the first place and not to take the pay cut. Now what's the alternative going to be to cover it? We have mandatory coverage.
Of course, that's already has happened over the last decade. A lot of salary increases have not materialized because of health insurance cost increases. But I think you're right. It probably is going to put some pressure on wages for some enterprises, because obviously there's not going to be a lot of room to increase compensation